to the Dementia Dish. My name is Danielle. I'm a public education coordinator, the Alzheimer's Society Peel. And today for our dish, we are going to be discussing dementia and hearing loss. And we have a wonderful guest speaker, Dr. Sherina Samuel, who owns the Bovaird Hearing Clinic and is also a co-author of the book, A Sound Mind. And who has a doctorate in audiology and was the first audiologist doctor in Brampton. So great to have you.
Thank you for having me.
And this is such an important topic because we do get questions all the time about the connection, now that it's been in the media and stuff, the connection between dementia and hearing loss. So I just wanted to ask you a little bit about the connection between dementia and hearing loss.
So yes, just off from the bat, there's been a lot of research in the last 10 years showing a relationship between hearing loss and dementia. It's actually not new. However, in the last 3 to 5 years, there's been some very strong research explaining possible processes and a lot of research showing how up to 40% of dementia cases out there may be preventable. And out of all the dozen modifiable risk factors, hearing has been shown to be the #1 modifiable risk factor. So it's a heavy relationship. We're trying to learn it more so that we're using hearing care in a more preventative approach to overall health care. And a lot of that research came from the Lancet article in 2017, which is a very old medical trustworthy journal.
Wonderful. So people can actually lower some risk factors by controlling their hearing and controlling those. So people should obviously be tested.
Yes, absolutely.
For hearing impairment. And if they actually do have a hearing impairment and they're recommended to wear a hearing aid, how many hours of a day should people be wearing those hearing aids as prevention?
Right. So in terms of being tested, hearing loss is actually most common type of hearing loss is age-related hearing loss. A lot of people think it's noise-based, or I don't have a problem. But just with over time, we as human beings, medicine allows us to live longer. Our ears, our vision, other systems lose sensitivity. So hearing loss is a natural decline in our sensitivity. However, our brain is meant to keep connected to full sound, to full vision, to perform optimally. So when the brain's getting gaps in sound, it's actually not able to function and is being stressed and trying to fill in those gaps. So to answer the question, being tested early, absolutely. Hearing is one of those things, why aren't we testing every 2 years like we do with vision? I find hearing in society is just neglected. Unless someone has a problem, then they're alerted, but it's seems not seemingly part of a regular routine to check your hearing health like you would your visual health or medical health. And in terms of if you're diagnosed and prescribed treatment, it's ideal to use it. Your goal is to use it every day, all day. I mean, as long as you're awake, your senses should all be intact. So I always recommend to my patients, you want to keep connected. The mind should keep connected to what things should sound like, so you actually perform better with full range of sound. So if you're used to having hearing loss and putting in these fillers and not hearing background noise, and all of a sudden you wear them because you're going out with some friends or you have a meeting, the brain actually is not accustomed to managing all that sound, so it has a harder time performing. However, when you ease into it and train it to listen and work with full range as if your hearing were normal, you tend to perform better. So I always tell my patients I would work with them until they're wearing it full time and they're at full range of sound, so that they pop them in and forget they're there. It should be that natural to them.
Wow. Okay, so that's really amazing. I think a lot of people don't know that. And you know, the whole fact that the brain is going to function best when it's hearing full sound is such a good reason to have your hearing tested and wear those hearing aids. So so glad that you were able to talk to us today. For more information, please get your hands on A Sound Mind and read the book, because there's amazing information Thank you so much, Dr. Samuel, for joining us today, and thank you everybody for joining our Dementia Dish, and join us for future dishes, and we'll be talking about lots more things to do with dementia.
Thank you for having me.